This is Gene Rossau, president of Iodine Products. Our discussion today is about insights and approaches to prevent macular degeneration. It's a narrative summary with current, novel, effective, and safe interventions. AMD, or age-related macular degeneration, is a major cause of vision loss in adults. It's driven by oxidative stress, inflammation, and genetic risk. There are limited conventional therapies, and these only address later stage neovascular disease. There are no reasonable preventative treatments that exist today, none. This synthesis explores mechanisms, consensus areas, controversies, and sound prevention options. It offers simple, useful, and very low-cost preventive, delaying, and helpful therapeutics. Our hypothesis is direct. AMD can be prevented and blindness avoided. Macular degeneration is a vast and costly problem. Its prevalence is really by age group. As of 2019, in a modeling produced by the Vision and Eye Health Surveillance System of the CDC, a sponsored initiative that collects eye health disease-related data, we find the following information. In the age group 40 to 44, approximately 2% of the population suffers from macular degeneration. Once you get over the age of 85, almost 47% of the population suffers from macular degeneration. And if you take the entire age group that's greater than 40, the percentage of prevalence is 12.6%, roughly almost 20 million individuals. Prevention, we believe, is possible, but it is ignored today. The economic value of illness and treatment is compelling for pharmaceutical companies. The prevalence of age-related macular degeneration rose from 8.5% of the population in 2010 to 12.6% as of 2019. This is a measurable increase of over 48% in just under a decade. Why? Bad diet, poor health habits, genetic proclivity. Here are some common pathogenic threads. First, oxidative stress with mitochondrial dysfunction in the organs and organelles of the eye. Complement activation, which is the dysregulation in the drusen and Bruch's membrane of inflammation and membrane attack complex. There is chronic inflammation in the retinal pigment epithelium and the choriocapillaris, which nourishes the outer retina with some of the highest blood flow in the body. We may come back to speak about the choriocapillaris, an absolutely remarkable network of blood vessels in the retina. And in addition, endothelial cell loss and the thickening of the Bruch's membrane. We have a slide here that shows the choriocapillaris at the bottom, which is this remarkable, incredibly fragile, but high volume, fenestrated group of capillaries, a fabric of interwoven capillaries, which are subject to ischemia and reduced perfusion. We have the intervening Bruch's membrane, which can be affected by the accumulation of drusen, a kind of protein interfering agglomeration. We have the retinal pigment epithelium, or RPE, which undergoes stress and complement-mediated injury, and of course photoreceptors, which suffer secondary degeneration due to upstream failure. There are several risk factors upon which all clinicians agree. in a general kind of way. They agree that age, smoking, hypertension, and genetics affect the potential for AMD. Those genetic factors are called complement factor H, genetic risk factor, and ARMS 2, age-related maculopathy susceptibility, which is a gene variant. In addition, elevated CRP, or C-reactive protein, plays a significant role in the etiology of macular degeneration. Apparently, there's an important feature of AMD that is sensitive to light exposure, especially blue light as produced by many LEDs, and this generates oxidative stress, which increases the potential for AMD. And of course, family history and dietary deficiency. That deficiency being found with the lesser intake of antioxidants, zinc, and iodine. Current therapeutic strategies involve anti-vascular endothelial growth factor injections for wet AMD. There are two types of AMD, wet and dry. And this injection process, which is typically done on a monthly basis, is moderately successful in delaying the onset of AMD and blindness for up to 2 years, or so we find at this time. And age-related eye disease study, which was done by the NIH, shows that micronutrient supplements can be significant in reducing the progression of AMD. It's very clear that lifestyle changes such as stopping smoking and changing certain elements of the diet can delay the progress of AMD. There is no proven therapy for geographic atrophy and the degeneration of various features, although the previous mentioned elements can have an effect generally. And there are 0 preventative medications at this time. But in this presentation, we are going to discuss potential preventative medications that we believe can be, and in fact, in some cases have been, quite successful. There are a series of unresolved debates that relate to the field of experts who try to determine what is the affect of the conditions for AMD. One of them is what's called the membrane attack complex, which is a variety of complement proteins. And the question about them is whether they are pro-angiogenic or cytolytic. We know that there is an initial insult that's driven by drusen and ischemia and inflammation, but we're not sure how these are integrated and related in the progress of the disease. We're pretty sure that there is both microbial and biofilm involvement, but there's disagreement on how it arises and how to treat it, and there's little question that there is vascular endothelial growth upregulation, but we are not sure of its causes or exactly its consequences. The first of 3 elements that we propose where we have seen meaningful, indeed important, delay in the progress of AMD is 1% PVP iodine. We call it step 1 in healing and prevention. 1% PVP iodine is the most antimicrobial concentration. It is far, far more effective than 10% PVPI, which would be unpleasant to use in the eye, and more effective than 0.5% or 0.75% of PVPI. 1% PVPI seems to be the sweet spot for both antiseptic and antiviral effects. 1% PVPI reduces the oxidative load as one of the core functions and features of iodine. It also reduces the potential pathogen burden, and there is little disagreement that reducing the pathogen burden will delay, inhibit, and in some cases put off for very, very long period of time the progress of AMD. 1% iodine also suppresses the inflammation that occurs in the eye via reactive oxygen species scavenging. And this is a feature, a direct, well-known feature of 1% PVPI. All iodine in the PVPI complex does this, but 1% is the most effective at suppressing inflammation by the scavenging of reactive oxygen species, to which the eye is constantly subject in daily life. And used in early stage indicators of AMD, it is especially helpful, both on its own and as an adjunctive topical. Our step 2 for the prevention and treatment of AMD is 5% DMSO in normal saline. What the field has found is that 5% DMSO in saline, or even in water, inhibits the nuclear factor kappa light chain enhancer of activated B cells, which is pro-inflammatory signaling. And it reduces or even totally inhibits inflammatory cascades. It preserves the original retinal thickness in animal models, and we are presuming also in humans. It enhances penetration and microcirculation, incredibly important relative to the fragile and extraordinarily significant influence of the choriocapillaris, the blood flow that feeds the life of the retina. And also this 5% DMSO in saline reduces the chronic inflammatory burden. So it performs a number of features that are preserving of the original health and functionality of the retina. And our third step for prevention and cure is a combination of tea tree oil, iodide, and a tiny amount of DMSO to assist in the penetration of the tea tree oil. Tea tree oil combined with iodide has a synergistic antimicrobial, anti-inflammatory action. It specifically and very, very importantly targets Demodex and the biofilm that can exist and frequently does exist on the eyelids. And without going into the detail of Demodex, it's important to recognize that Demodex are the most successful parasite on the planet. Virtually every human being carries Demodex. Its reservoir is the scalp. Demodex migrate from the scalp downwards towards the nose, sometimes producing Demodex rosacea, but before it comes to the point of producing Demodex rosacea, Demodex cause a tremendous degradation of eyesight and extraordinary discomfort by housing themselves in the eyelashes, the eyebrows, and behind the eyelashes in the meibomian glands. The reduction of meibum and the flow of meibum to the eye caused by Demodex is catastrophic to the general health of the eye. And tea tree oil is very effective at targeting and reducing Demodex. It reduces the progression of AMD via ocular surface inflammation and by killing microbes. And we will add here, only as a step in passing, it's extraordinarily important to recognize that when Demodex are killed and lice, they release millions of bacteria and viruses, each one of them. And by having iodine present as PVPI 1% in the eye, simultaneous or subsequent or preliminary to the use of tea tree oil, those microbes are killed very, very rapidly, literally in seconds. So the combination of tea tree oil and 1% PVPI is essential in the treatment and prevention and possible cure of AMD. General conclusion. Age-related macular degeneration arises via a complex interplay of genetic, inflammatory, and oxidative mechanisms. About this, there is no disagreement. Current treatments are limited and unpleasant, and I should add they're expensive, typically about $1,500 per month, a once-a-month injection into the eye. Not a nice idea. It's not as horrible as it sounds, but it's still not a nice idea. We have no focus on preventive steps. This is a bad approach to medicine. Prevention, as our parents would have told us, is worth an awful lot more than cure. Half of the aging population will become blind, and therefore prevention is something that we must develop. It's a core medical process we have to work on. But in the current environment, which is only oriented towards treatment, it will not occur. It is neither financially appealing to pharmaceutical companies, nor is it under investigation, because being financially not especially viable, the investment in prevention is not something that is being done today. And I doubt that it will happen in the future, in the near future. It will have to happen in the distant future. So we're talking about 3 stages of preventative activity. The infusion of iodine is PVPI 1%, the use of 5% DMSO in normal saline, and the infusion of tea tree oil with iodide and a tiny amount of DMSO, which have demonstrably shown powerful disease-modifying potential. These are 3 powerful preventatives that should be used in sequence and in concert. Thank you for listening. We are ready to assist you. You can call us 24/7 at 305-667-9375. This is Gene Rossov, President of Iodine Products in South Miami, Florida. Thank you for listening.